Now, somebody else told me this, and I want to hear your thoughts on this, that for people who like to eat, to consume a lot, to deal with whatever pressures they're facing, whatever disappointments they're facing, whatever frustrations they're facing, what you should do is, doctor, eat slowly. I'm not making this up. People have suggested, but what you do instead of wolfing, eat slowly. The slower you eat, take smaller portions. Then you go back for more. So you just eat real slow. What do you think about that?
You are absolutely right, Ben, about it. Because your brain takes some time to register the food. So if you swallow like 5,000 calories without even your stomach stretching, hey, there's a problem because all those calories are in you. Now, if you take your time, chew properly, that's why they say drink the water before, maybe eat the salad before, maybe take some fiber before, to let your stomach stretch so it recognizes the signal. That's called mindful eating, Ben. Enjoy, chew, relish really every bite what you are eating and not just gobble it down.
All right, now let me ask you this question. A lot of people who are experts in this area look very healthy, they look very vibrant. It makes me think that they have never suffered from the ailments that the other people have suffered for that are in their class. You look very healthy and very vibrant. Do you know all about healthy eating from your own from studying it in a book, or have you yourself gone through your own transformation?
Oh my God, Ben, I'm so glad you asked the question. I lived through it. I've been practicing medicine for almost 25 years, and first 10 I spent in doing the traditional medicine. And, just seeing the patient one after another after every 15 minutes. And, by the end of the day, I was exhausted, I was tired. And you look at me, I'm not that tall. I weighed almost 175 pounds. That, for my frame, is a lot of weight, Ben.
You weighed 175 pounds?
You are right. You are right. That's a lot for my frame, right? But one of the days, I was walking through those hallways, and I did the same thing. Oh, I'm going to do something really good for myself, and I'm going to take the stairs. And I was actually climbing the stairs to go to the hospital floor. And by the time I reached the floor, I was huffing and puffing. And you have that moment when the light just dawns on you. That was that moment. And I said, oh my God, if I keep doing this, I'm going to drop dead myself walking these hallways, and neither I'm doing good to myself nor to any of my patients.
No.
And I said, now it had to get better. And I started implementing the functional medicine approach to my own body, working through the 5 fundamental pillars of health: nutrition, vitamins, right nutrients, optimizing the hormones, stress management, and then right kind of exercise.
Now, Dr. Meena, when you gained all that weight, was there a particular kind of food that you had an addiction to, that you were eating a lot? Maybe our listeners could...
Just like everyone else, those sweets, and I was in between the patients, and I said, I cannot focus. I'll go get to the candy or M&Ms, I am M&M, but my patients used to call me Dr. M&M because I'll have one and I'll share one with them. But, I was myself victim of that feeling good for 5 minutes. But once I addressed those 5 fundamental pillars of health, it turned around. And you know what? Who noticed first? My patients, who I was telling all of them all the time, hey, you have to lose weight, you have to lose weight. And as I started shrinking, they said, hey, what are you doing? You're looking good today. Tell me what you're doing. That's what I want to do. And I said, oh, will you do what I'm doing? And I shared. And that's how all this started. And they did better. And now, before they know it, I say, hey, you don't need that blood pressure medicine anymore. Hey, you're taking that medicine for the sugar? Your tests look good. Your sugar is dropping too low. Let's get you off that. Let's cut this down. Let's get rid of the cholesterol medicine. And that was the transformation for me and my patients. And we traveled, and once we got it, once we make the system, I said, why not? My God, we all need to. My mission is to give this option to every single person who is living through it, who is suffering from diabetes or blood pressure or cholesterol or heart disease, and they have been told that, hey, once you take this pill, you are stuck with it for the rest of your life. You can never get off this, never stop it. I'm telling you, 95% or maybe more than 95% of the time, that's lie. And if you reclaim, if you regain control of those fundamental pillars of health, what we talked about, nutrition, vitamins, optimizing your hormone, right kind of exercise, and stress management, you can reclaim your health. You can get rid of those pills.
Doctor, do you have any more interest in eating M&Ms anymore?
No, I can pass by them like, oh, who are you? I already feel so good. I don't need you to feel good.
Yeah.
And Ben, I know I'm throwing lots of information on you and also to my listeners.
Yeah.
And there's a lot more. This topic is so wide that, you know, we're barely scratching the surface.
So is this a seminar, or do you also lead your followers through exercises?
All of it, whatever they need. I want to give them the solution. I want to lay the path out for their health. We find out, we talk to each other, we figure out what their goals are, what they have done to get to their goals, what worked, what didn't work. And once we are on the same page, understanding their goals, understanding their history, we lay a plan of action, a path for them. And if they can see themselves walking that path, hey, we shake hands and we move forward. And that's the process I take. We don't even call them patients, because they're not patients. They are not sick. We said our practice members, the participants. And just call us, talk to Dasha at 847-665-9877. You know Dasha, yes.
847-443-9444, The Healing Cure. Dr. Meena, I want to wish you a happy Thanksgiving, and I hope that you eat with restraint and wisdom, and I will be doing the same thing. I'll be eating small portions. I'll be eating slow. Will I go for seconds, Dr. Meena? Yes, I probably will go for seconds. Will I go for thirds? I may go for thirds, but it won't really matter because my portions will have been smaller.
And absolutely fine. Enjoy the meal. It comes once a year. Just don't make those leftover last you till Christmas or the next holiday. It's a meal. Enjoy. Live the life. Because if we deprive, that will never last long.
Very good. I want to thank you very much for coming here. One more time, give the information out if people are interested in taking the seminar.
Hey, you can come to our website, healandcure.com, HEALNCURE.com, or call Dasha at 847-665-9877. We'll hold a spot for you. I look forward to seeing you all, and you all enjoy the holidays.
I'm going to enjoy that holiday. I cannot wait to dig in, but I'm going to eat small portions. And most important, Dr. Meena, I'm going to eat slowly this year. I promise you. All right, Dr. Meena?
Mindful eating, Ben.
All right, very good. We'll be right back after this.
All right.
Good job.
Okay.
Man, 175 pounds. You have lost weight, young lady.
I have.
Doctor?
I have.
I know that, Dasha. I heard her on the phone.
Okay.